Going into my pregnancy, I was your typical 27-year-old female. I was relatively healthy, active, had no health problems. Looking back, I noticed there's a point in time at the end of my pregnancy where I was feeling bad, but it's my first time to be pregnant. I thought it was normal to be out of breath. I just thought, it's pregnancy, I'm not gonna freak out. This will be over with in a few weeks, hopefully. After my postpartum period, things progressively got worse. There were small things I was noticing at home, like putting her car seat in the car, I would kind of be short of breath, and folding laundry, I'd be short of breath. Again, ignored it. That's kind of the common theme throughout these months, is that I ignored it.
I remember around November, December, Abby started to ask a lot more questions about, can you have heartburn in your back? I've got this burning sensation in my throat, and we kind of discounted it at first because, you went from, basically just caring for yourself to all of a sudden you're carrying around a 10-pound baby.
We kind of came to the conclusion that maybe I'd pulled something in my back.
The pain got worse. The burning in her throat became more, it was more serious. It was happening more often, and so that's when we really started getting worried about it.
I remember sitting at my sister's house, pulling up Google, which is one of the most dangerous things anybody can ever do. I was determined that I was about to diagnose myself, so I typed in all my symptoms, and everything led back to women's heart health issues. And that was the first time, I think, that I really realized something's wrong. I remember Dr. Hayes walking in the room. He started to do his routine test that he does on any of his patients that could have potential heart issues, and all those things checked out completely normal. And at that point, with the symptoms I was having, with the pain at my shoulder blades, shortness of breath, and the burning in my throat, and just having had a baby, he decided to take it a step further, and he ordered an echo and a CT with contrast for the next day.
We talked about her symptoms, and I said, this is really unusual for somebody her age, but we needed to make sure that she was okay. And so we had her undergo several tests. That's when we diagnosed her with coronary artery disease.
It was just a normal morning for me. I went to work, and I remember it was around lunchtime, I got a call from Abby. As soon as I answered it, I knew something was wrong. And I remember her telling me that Dr. Hayes just called, and he said that there's an anomaly in your CTA.
My sister-in-law came by to give me something right after I'd gotten the phone call. And I remember her looking at me and saying, "You're gonna be okay." And I said, "I have to be okay. I've got, Callaway's depending on me. Everything is gonna be okay."
So remember we got to the hospital, and they rolled Abby back and started the cath, and started the heart cath. And about 15 or 20 minutes later, I got a call from Dr. Hayes, and that's when it really hit me. And he said, "Ben, we're right in the middle of the heart cath, and we've discovered a blockage in Abby's LAD, and it's 80 to 90% blockage." And that's when it really hit me that this is real.
How is this all happening? How am I sitting here with a stent, 27 years old? I've never had a health issue in my life, and I'm now on the heart floor of St. Dominic's. I remember waking up the next morning after my stent and immediately bursting into tears. I don't think Ben was even awake yet. And the gravity of the situation really hit me. What does this mean for me in the future? What does this mean for our family? What does this mean for my daughter and our future children? Can I have more children? I have a stent in my heart now. I didn't know really how the rest of my life would play out now as a heart patient. I think the question I get asked most often is, why did this happen? I want the answers for my daughter's future. Now that I've had this happen at such an early age, it puts her at risk for heart disease at an early age. So my hope is that in the future, the funding raised through the American Heart Association can help find those answers so that Callaway can live a life free of the worry of the potential threat of heart disease. From the very beginning of when I started reaching out to figure out what was wrong with me from Google sent me to the American Heart Association page that gave me my first tip-off that something might be wrong. Even the tests that were run that very first day that I walked into the doctor's office, the EKG, the blood tests, even up until the stent was placed, was all due to the research of the American Heart Association.
Our big concern now is, what does this mean for the next generation? What does this mean for Callaway? What does this mean for others who are impacted by heart disease. And I think that is one of the key things that we have to continue to push towards is getting those answers, is funding that research. And that's why the American Heart Association is so important to us, is that we know that is how we get those answers. That is why we want to continue to fund the American Heart Association, so that when our daughter is 25 years old, that we'll know if she's at risk, why she's at risk, and what we need to do in order to get it fixed.
So the American Heart Association has played an instrumental role, particularly in research, when we're trying to find different ways to diagnose people with heart disease at an earlier stage. Research has been very important to get that done, and that's one of the reasons why we have to contribute to the Heart Association to make sure those dollars are out there so that research can be done to really try to see not only can we prevent it, can we find the cure for heart disease. That would be fantastic.
If I had one message to convey, it would be that you can't live your life in fear, but you can live it with awareness and initiative, to be proactive with your health, to listen to your body, and to not be afraid to reach out. I'm so grateful for all my doctors, the rehab, my recovery, and getting me to this point to where we are going to be able to expand our family, and we're going to be expanding our family in June. So we're grateful, for all the funding and the research the American Heart Association has provided to get people to this point, to help them live a normal, healthy life